Welcome to Topic 7, Research Reviews in Health Informatics. My name is Cherie Lloyd. In this topic, we're going to learn about research reviews and why researchers in health informatics might use tools such as systematic reviews in their work. We're going to look at systematic reviews and learn about what a systematic review is. And all researchers in all fields, including health informatics, should be able to read a systematic review. They should be able to read it, understand how to conduct a systematic review, and apply the tools of systematic review in their research practice. So after studying in this week's course content, students will be able to critically evaluate published research in health informatics in the context of their professional practice and understand the items that might be used or included to evaluate research in the health informatics field. So we're going to look at systematic reviews in this lecture, and we're going to look at them from two different viewpoints. So firstly, health information researchers may read systematic reviews to inform practice or to identify research gaps. You may decide to use a systematic review as a methodology for your research project. So let's look now at what a systematic review is and how they might be utilised by researchers in the health informatics field. So a systematic review is a methodical way of summarising research evidence. It's a collection and analysis of all of the body of research in a particular area. Shields and Liam Putong state in their text that a systematic review is a comprehensive identification of the available literature on a specified topic. They note that systematic reviews can be used as a tool to review the literature in any area of health. A systematic review is a useful tool to collate previous literature. A systematic review adheres to a strict protocol with well-defined methods. In this slide, we've got the step-by-step guide that's suggested by Shields in the Liam Putong text. So the first step is to set an answerable question for the systematic review that you're going to conduct. Secondly, to decide on a strategy that will comprehensively enable you to search for evidence. And thirdly, identifying the inclusion and exclusion criteria. So what studies will you include and what studies will be excluded? The next step is to assess the quality of the research articles and/or reports. A systematic review will then normally extract standardized data from each article and/or report and summarize and synthesize the findings of the review and draw conclusions. These authors also note that the systematic review can help researchers to cope with large volumes of literature by summarizing it and providing reliable evidence to aid in decision making. One of the aims of a systematic review is to identify gaps and strengths and weaknesses in the current literature, and this assists researchers with their design. The method that is used to conduct a systematic review should be able to be replicated, transparent, and scientifically rigorous. So let's look at why we critique research. According to the dictionary, a simple definition of critique is that it is a careful judgment where you give your opinion about the good and bad parts of something, such as a piece of writing. Critique is an important academic skill, and health informatics researchers need to be able to review research in their area to identify both its strengths and weaknesses and how it might be applicable to the practice of health informatics. As a health professional and health manager, it's important to be able to apply best practice, to identify what's best practice, and to evaluate and use published research in your work. A very valuable skill for health informatics professionals and health services managers to possess is the ability to critique a paper. Greenhouse, in her 2014 text, How to Read a Paper, suggests that the first step when reading a research paper is to get a broad overview of the paper and to consider what the research was about, what was the research question and why was the study conducted, what was the aim of the project, what was the research design that was used, and was the research design and methods that were used appropriate to answer the research question. This is a really valuable text, and at the end of the text there's a series of appendices, and in these appendices are checklists that can be used by researchers to assist them in appraising and implementing evidence. So there's a number of useful checklists in the lists, including checklists to determine what a paper's about, checklists to analyse the methods section of a paper, checklists that might be applied to a qualitative research paper, and checklists for papers that may be, for example, describing a quality improvement study. So as a researcher in health informatics, you may review and critique a paper around the following criteria. So you might consider what type of study was performed, what the aim of the study was the study design appropriate to the field of research, and was the study design sensible, and was it going to enable the researchers to satisfactorily answer the questions that they've posed. You might also critique around the sample size, so was the sample size large enough, continued for long enough, and follow-up complete enough to make the results credible? Has bias been avoided, and is the study able to be replicated? Have appropriate ethics approvals been sought, and did the researchers describe the method in sufficient detail? When critiquing a paper, you might also consider whether the results are credible. Have the conclusions that have been drawn from the paper, do they make sense in terms of them supporting what is demonstrated in the results section of the paper? Do you think sufficient analysis has been provided? And are the findings relevant and useful? Do you consider that the researchers have considered areas for future study, and have they acknowledged study limitations and weaknesses? Can the findings from the research project be transferred or generalised to other sites or settings? So there's a number of tools to assist researchers to assess research. The CASP is one example of this, and CASP stands for the Critical Appraisal Skills Program, and it's part of the Better Value Healthcare organisation that's based in the United Kingdom, and it's developed tools to help researchers critically appraise different research, and they provide checklists and other tools. It's certainly worth having a look at, and the link has been provided to you on the Learning at Blackboard site. So finally, we look at areas for potential health informatics research. So there are a number of domains around which researchers in the health informatics fields may focus their attention, including clinical communication. So this is considering the application of information and communication technologies to the clinical communication process, to aid what is safe and effective, to consider which tools are best and how best to support and improve clinical communication. The other domains are information systems such as computerized physician order entry systems. These are most commonly seen in hospitals with in-house ordering of pathology or medication systems, and this enables clinicians to directly order their pathology tests, imaging and drugs to the computer, and this is routed to the relevant departments for scheduling or provision of drugs or other tests that might be required. Another example for health informatics research is in the clinical decision support area, And this is a clinical decision support system, those that are built into clinical care applications to support clinicians to make clinical care decisions. So for an example might be tools such as electronic versions of prescribing tools such as MIMS that support clinicians to order their medications. They may be sophisticated tools to assist with the prescribing of antibiotics to ensure that appropriate stewardship and prescription of antibiotics is being conducted and that the appropriate antibiotics are being selected for the particular bacteria that the patient may have in their system. Another domain is clinical. Another area that may be the focus for health informatics research is clinical error prevention. So clinical error prevention is looking at applications and systems that can monitor data inputs into clinical care and make early warning alerts where an error may have or may potentially occur. Another area for focus might be in the area of information and data quality. So there's a growing research interest in health informatics, and it's one thing to have computer applications collecting health information and supporting clinicians, but they must have confidence that the data and information is correct and accurate. Unintended consequences. So this is research that investigates both the positive and negative and unintended consequences of the use of ICTs in healthcare. There's projects that are being conducted into how new ICTs can be utilised and how these apply to healthcare. So this might be research in the areas of mobile health, wearables, and some of those other innovations. Workflow, so looking at how ICT impacts on clinical and clinician workflow. Workforce research around the health informatics workforce. What are the needs? What type of training is required? How many staff? What are the skills, etc. So in this topic, we've learnt that systematic literature reviews are an important tool for researchers in the health informatics area. A systematic review seeks to determine all relevant published evidence around a particular topic. Researchers in health informatics need to be able to read systematic reviews and to be able to critique other research papers and identify their strengths and weaknesses. This will help health informaticians and health service managers to incorporate the best available evidence into their work practices and can be used to inform their research projects.